is December 2nd, 2015. My name is Kaylin Queen.
My name is Brianna Miller.
And we're looking to expand our business from the United States to China and Japan. We're the owners and founders of an insurance company in the United States. So we did our research to see which two countries would benefit our business the most and which would be the most profitable. And in our research between the two countries, I'm going to let Brianna tell you a little bit about Japan, and I'm going to tell you about China.
In Japan, their population is rounded about 127 million people. Their average income is 37,500, and the unemployment rate is 3.6%. So these people that have a good income will be able to get our insurance. And in Japan, their health insurance law came out in 1922 and was implemented in 1927 for companies. In 1938, insurance was extended to the farmers, fishermen, foresters, and other groups that were not covered in the previous 1922 law. In 1958, the remaining 30% of the population was covered. In 1961, everyone was covered either by employers or by the government. And that was all founded on an article by the name of Japan's Universal and Affordable Health Care Lessons for the United States. In the Worldmark Encyclopedia of the Nations, they said that the business law was revised in 1997 and that all the insurance that Japan has is life, car, fire, accident, marine cargo, marine hull, workers' compensation, nuclear liability, and health insurance. But then in 2011, they had added in property insurance due to all the natural disasters such as tsunamis and earthquakes. So now Kaylin is going to talk about China.
Okay, and like Brianna had discussed in the reasons why we were looking to expand in Japan are some of the reasons why we're looking to expand in China. In China, it's very heavily populated. They have about 1.4 billion people, so that's a lot of people that are in need of any type of good health care that we could possibly provide. Their income, or their average income per year, is around $13,200 with an unemployment rate at 4.1%, which pretty much puts them at a pretty solid employment rate. Seems like everybody's pretty much working in China, considering that they have 1.4 billion people. And our insurance, we're looking to offer, basically based on income. That way it's affordable to everybody that is working. I did my research into this to look and see to why people may need health insurance in China. China, their health care isn't up to standards, as you would say, as it is in the United States. Their systems, they tend to neglect a lot of their patients if they can't afford health care. So for instance, if you can't afford to pay for any type of illnesses, injuries, or anything like that, they're known to neglect a lot of their patients, and you can, some patients end up dying, losing limbs, or anything like that. So it's important to have insurance, and we want to, cover and bring the same type of, insurance health care that we provide in the United States to these foreign countries. In China, there are two types of hospital care systems. You have a public healthcare system, and you also have an international hospital. So you have public hospitals and international hospitals. There's two differences. In the public hospital systems, you don't have much or any private at all when it comes to healthcare. So you could be getting treatment with like people standing around you, and it's not very sanitary or very clean. They use very little like sanitation procedures. The waits are long, and it tends to be more expensive. So it's not the first choice if you want to get treatment. And nobody speaks anything but that one language in China. The international hospitals is the exact opposite, however. In these hospitals you have more privacy, it's a little bit more affordable, and you have people who speak multiple languages. But so those are the ones that we kind of want to get to, bringing that type of healthcare to those countries. And we want to provide the type of insurance so that everybody can get fair insurance. In an article in 2009, the government announced major health reforms. Wang said that the public was unhappy about healthcare being affordable, and the fact that people had unequal access to healthcare based on status and where they lived. So we want to make sure that everybody has an opportunity to have fair and affordable insurance and have access to it. If anybody wants to get in touch with us, we have business cards with our information. Like I said, we're the founders of Yellow Cross Health Insurance. We have our number, mine and Brianna's name, if anybody needs to contact us. We will provide insurance that will cover medical expenses, hospitalization treatments, medicines, and emergency transportation. And like I said, it will be affordable based on income. We'll also have low co-payments for doctor visits, $5 co-payment. So it's very affordable. Common illnesses in China, basically nothing any more different than the United States. You have Alzheimer's, dementia, COPD, lower respiratory infection, stroke, heart attacks, and all these can be preventable diseases, but they can be very costly, and we want to provide the type of insurance so that everybody can afford to be taken care of and make sure that they can live long, healthy lives. The average life expectancy in China is 76 years old. I'm going to turn it over to Brianna, and she's going to tell you between Japan and China which we chose and the reason why.
Based on the fact that Japan has basically the same insurances as the United States, while China does not, we chose to expand to China.
All right.